Good evening and happy Wednesday. Welcome to blackdoctor.org. I'm your host, Shameika Rhymes, and you guys know this is Soulibration. Welcome. Let me know in the chat where you are watching from and how you're doing this evening. And remember to share this with your network. And if you have any questions at all, you guys know you're the co-host. Drop those questions and comments in the chat. And I am so excited about tonight's show. So, are you curious about body sculpting, fat transfers, or facial aesthetic treatments, but kind of overwhelmed by the options? And I can't be the only one that looks in the mirror thinking, I wish I could just move this over here or put this here or just nip tuck this or, all those things. Let me know if you've ever felt that way in the chat too. So tonight we're cutting through all that noise because especially on social media, we see all kinds of different things, but we're going to give you some real insight today into the most popular cosmetic enhancements, from laser lipo to PRP facials and non-surgical BBLs. We're going to talk about what works, what's safe, and what to know before you decide to sign up to do something like that. So whether you're looking to just boost your confidence or you just want a natural refresh, this conversation is for you. It'll help you make informed, empowered decisions about your body and appearance. So let me tell you about tonight's guest. Tonight joining me is Dr. Rudolph Moise. He's a board-certified aesthetic practitioner and the founder of Comprehensive Medical Aesthetics in Miami. He's originally from Haiti and a former U.S. Air Force flight surgeon, and he brings over 30 years of medical experience to the world of advanced non-surgical cosmetic treatments. And I am super excited. Let's bring on Dr. Rudy.
You?
Hi, how are you?
Doing great. Thank you for inviting me.
Welcome, welcome. I see in the chat, I see Gastonia, Asheville, Charlotte. Welcome, everybody. So we have to kick this off with, there's so many buzzwords. I know I spent one night just on TikTok going down a rabbit hole because I thought, now, is there a better way to do lipo? Like, I want to try it, but is there another way? But anyway, can you tell us a little bit about fat transfer, body sculpting, laser lipo, like what the differences are between all those things?
Okay, first of all, let me put this into perspective for you. Okay. For the past 40 years, okay, the average American man has 5 inches increase in his waist, and the average American woman 7-inch size. Exactly. So, and this is due to what? With diet. There's increased consumption of fast food, high in sugar, processed food, lack of activities, lack of exercise, and all type of the complications. So that's what has been a boost, an explosion of liposuction, because people want to look good. People do not want to be overweight fat, so they want to look good. So there's been an explosion of liposuction. In 2023, there was about 350,000 liposuction done in the United States. 350,000. Now, for 2024, the Plastic Surgeon Association have not released the number yet, but I'm pretty sure it's up to about 400,000. And the second question I like to kind of point out is that 82% of the procedures now are non-surgical, because people wants to return to work as soon as possible. They don't want no downtime. And only 16% of 18% are surgical. People will need to have like a surgical facelift or breast implants or tummy tuck. So this is just to put things into perspective. Now, to answer your question, and what fat transfer? Well, fat transfer is the same way that you describe it. This is taking fat from certain areas in your body and transfer it to another area that needs volume. The most common area that people remove the fat from is the upper abdomen, lower abdomen, your arms, your back, the sides, and the thighs. And then the most common places that they transfer it is the face. Okay,
really?
Because the face, because you want to add some volume in your face, the breast, and as you know, the butt, the pop.
That was my question. I'm like, can we put it back there?
those are the, and also for a few cases, sometimes as you get older, your fingers, your hands tend to be little skinny, and you have all the veins showing up. So by putting the fat there, it helps kind of give that youthful appearance of your hands as well. Okay, so that's one area that is commonly done as well.
You're
Now,
gonna have me walking around, Dr. Rudy, looking at people's hands.
now the second thing is body contouring.
Okay.
It's basically to it could be surgical, it could be non-surgical.
Mhm.
If it's surgical, then obviously you have to do liposuction and remove the fat in the area that you want it to be removed. If it's non-surgical, and the advantage is that there's no downtime, you can return to work the same day. Okay, we use like ultrasound to remove the fat. We use radio frequency to help tighten the skin. Okay, and then lastly, you have the laser liposuction. We use laser energy to remove the fat as well.
Oh, okay. So with non-surgical, what usually, and I know I'm jumping ahead in our questions, but now I'm just curious, what does that downtime look like? Is it literally you can go back to work the same day or a
Yes,
couple
yes,
days
you can.
later?
Yes, you can. It's like if you need dramatic results, so you do surgical.
Hmm.
If you're non-surgical, you go back to work the same day, but it requires several sessions. At least 6 sessions that you have to come in once a week to get this done. But there's no issue. You after your treatment, you go back to work and come back next week and get the follow-up treatment, and then it builds up over time, and then 3 to 6 months you see the maximum results on this as well.
So is body sculpting and body contouring, is that the same thing?
Yeah, it's the same. It's the same thing, different words, but
Okay.
it's exactly the same thing.
Okay. Okay. So what areas mostly when people are wanting to do the contouring, is it just mostly the abdomen that they're focused on for that part?
The abdomen is one major area. The arms, people,
Mhm.
the wings. People don't want to have the wings, and a lot of women, for example, they want to dress sexy. They want to show their
Mhm.
arms. And if the arms you
Yeah.
have some hanging stuff there, so you need to get it removed. So the arms is one area, and the thighs, because a lot of people they're overweight and their thighs tend to rub
Ah,
against each other. So it's not too you get sweaty there. It's promoting you to have some kind of fungal infection there.
mhm.
So it's when you remove it, I mean, you have more room there, and it's makes the person feel more comfortable and things like that.
This is really random, but I just thought of this in my head since you were talking about adding fat maybe to the breast area. But can you do a breast reduction non-surgical, or is that something that's medical that you have to be down for a few weeks or however long it takes?
That's a very good question. First of all, let me clarify something. I'm sorry to be graphic, but
That's okay.
if your nipples are straightforward,
Hmm.
okay, then you're a candidate to have fat transfer to your breast to give it a nice and round shape.
Okay.
However, if it's pointing down, fat transfer is not going to do it. You need to have surgery. You need to have breast implants and so on. You understand?
Oh, yes. Okay. That
Now,
makes sense.
now, to get you cannot do if you need the fat removed from we can get some fat removed from your breast if you have huge breast. However, it's better to have like a surgical because it's just better to do this. Otherwise, if, you'll take too long, and sometimes there's a symmetry issue. So it's better to go surgically to get the fat removed, like what they call memory reduction, and get the smaller size and so on.
Okay. I see a question in the chat for you. Lynette McCall wants to know, for the arms, is contouring a better option rather than having the skin removed?
The skin or the fat?
I'm going to assume she probably means the fat.
Yeah, the fat. It's I've done both. I've done both. But the if you do like a laser liposuction, and again, there's a difference between the laser liposuction and the
Mhm,
traditional surgical liposuction, because the
mhm.
laser is quicker. It's if you have some mild to moderate fat versus large amount of fat, that you have no choice than to do the surgical liposuction. And then, to me, I would recommend the laser liposuction because it's quick, and you remove the entire fat in your arms, and then you use the laser also or to have tighten the skin as well. So not only remove the fat, you have tighten the skin as well. So it's quick and it's very, very efficient. You just have to wear the garment to keep your arms tight and so on.
Oh, tell us about the garments.
The when the surgeons, when we do procedures, okay, this is only 50% of the work. The other 50% is on you. And that means that following the doctor's recommendation, the post-op care is so crucial. It is so crucial. The garment, depending on the area, is used for several reasons. Not only it helps decrease the swelling that you have. Number two, it helps with bruises because it compresses the blood vessel. Okay, so he helps. So he helps with the bruises. Okay, he helps for comfort as well because he helps with confidence and so on. And it just helps with the overall result of the liposuctions. And you have to put it on. You have to leave it on for several weeks. The longer you put it on, the better the results. And people can tell you that it feels very, 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 very comfortable. Now this is, and for the arm, the same thing. You have one. You have one for the neck. I mean, you have different garment for different areas treated and so on.
Is that what they call, at least for the abdomen? I TikTok. Faja? Is that what it's called? A faja?
Is a Spanish word for it. Very good. You said it pretty well too. So
okay, yay! I'm learning a lot from TikTok.
For the faja, because a lot of it are made in Colombia, and in Latin America, mostly Colombia, so they call it faja.
Okay. Because we see a lot of commercials on TV for, like, at least here in North Carolina, for different medical spas, and they always say, like, there was it makes it sound like some of these procedures can be done and that's it, one and done. But you just mentioned a few minutes ago that sometimes there's those procedures you have to come back for several times. What would you say to someone that's thinking about getting one of these procedures? Let's just go with laser lipo, for example. What should they know before they decide to call one of these places or call you? Is there anything that they should know before doing that? Any research they should do? Anything like that?
Well, it is always good. The better prepared that you are, the better that it is. It's so easy to deal with somebody who's educated, somebody who's done their homework. They Google laser liposuction. They know about it. All we have to do is to reinforce what they learned, okay, and then just go in and do procedure. Now, the expectations is also important. You said, what exactly do you want to do? You want to remove the fat? Well, usually we do a full consultations. A lot of people want a 360. What does that mean? Well, it's upper abdomen, lower abdomen, the lower handles, the broad line in the back, and also the back, and less commonly the arms and the thighs. But the 360 is mostly the abdomen and the back. And for when you do the laser lipo, it takes like several hours. Take like good 4 or 5 hours, and we do that under local anesthesia. We do a tiny incisions, very tiny incision, the size of my pinky here, the nail, and then we do it on both sides, and enough for the cannula to come in, and we put the IV fluid, with epinephrine and which help with the vasoconstriction, to avoid bleeding, and also lidocaine for the pain, and then we inject that, and then when it's ready, then we actually slowly, go ahead and remove the fat, and then the person is talking to you, listening to some music, things like that, and so on. And yes, and it's a very, very fun procedure. And the good thing about it is that if at some time the person feels uncomfortable, like that, you can readjust the cannula because the person is live, right there with you, as compared to the mechanical one where they put you to sleep, you're under anesthesia. And then sometimes if the doctor goes too deep, can cause perforation. The patient is sleeping, they cannot tell you that it's painful, So that's one of the complications that you may have. So I love the laser lipo. It does both. It uses fat and also help tighten the skin as well. So it does both. So, but it just takes a little longer because it takes time to go through the process to do it the right way.
Okay. And I was wondering, I've heard a few people say they wanted the 360, and I was like, I don't know what that is, but thank you for explaining that because I had no idea what that even meant. Um, and let me remind everyone in the chat, if you have questions, please feel free to drop those questions in there. So how long do the results last from whether it's the fat transfer, the body contouring, or laser lipo? And what should people expect in terms of maintenance?
Okay. The when you remove the fat, okay, it's obviously permanent. The fat that you actually remove is permanent. However,
Mhm.
you don't remove 100% of the fat. There's always some fat still there,
Right.
which is good. However, if you don't follow a diet, if you keep on eating processed food or fried food, food with sugar, what happens? Then you get a lot of you get a lot of weight back. So I see a lot of people who actually had surgery all type of gastric bypass surgery and so on, and they lost like 80 pounds. And
Mhm.
after that, they start eating again, they gain all the weight again. So
Oh,
it's. I mean, if you went through all the headaches of preparing for the surgery, you spend your money, a lot of money, because it's not cheap. Insurance rarely pay for that. You have to come out of
mhm,
pocket, and then you go back to the same habit again. Come on,
mhm,
you really have to decide on your own. Say, look, I want this. I want to look good, and I'm going to put all my effort to make sure this is successful. And
mhm.
the second thing is that you have to know is that um, 30 to 50% of the fat that we transfer usually get reabsorbed into the body. So not all the fat stays. Okay.
Okay.
So 30% just get absorbed by your system. So only 50% of the fat remains. But when it means that for life. For life. So
Mhm.
as compared to, for example, if you do the fat transfer to the face, for example, it stays there for life as compared to the fillers. Every 8 months, 9 months, you have to go back to the doctor
Mhm.
to get fillers in, because then it goes away, but the fat stays there permanently. So this is what is it's a little bit more expensive to the fat transfer, but then you save at the end, because like that you never have to do it again.
Oh, okay. Okay. That makes a lot of sense. I forgot to ask, do you do and I don't know if there's a such thing as a for a tummy tuck, because I guess if you're just going to do lipo, is there a need for a tummy tuck, or is that another thing that would need to be done like a medical surgery versus non-surgical?
Yes. When we first examine the patient, do consultation, the patient, the client, whichever term that you use, we evaluate the skin, we evaluate the amount of fat, and if we see that if you remove the fat and you could have like sagging skin, okay,
Mhm.
at that time, then you're going to need to have tummy talk. And then we don't do tummy talk. We have to refer
Mhm.
to a plastic surgeon that actually takes care of that. So I say,
Okay.
instead of having two surgeries, let me go ahead and refer you to the plastic surgeon, and he'll go ahead and do the procedure for you. Not only liposuction, but he'll do the tummy talk for you at the same time as well. Like that. Everything is done. But this is for people who have that sagging skin, and then remove the fat, then the skin is even more sagging and things like that. So
Right.
there is nothing. There's some equipment there's an equipment they call quantum that I've seen by InMode. InMode is one of the company that does that I've seen that using the quantum. I've seen some presentation going to different conferences that it help contract the skin significantly.
Mhm.
However, it doesn't remove the entire sagging. So you need to have a tummy tuck.
Ah, okay, okay. I'm learning so much. What about you guys in the chat? Let me know if you have any questions. So I just had another question that just escaped my brain. Let me go back to my list then. With these the things we have been talking about, the procedures, and I've known people that have had lipo and then they wear their faja, but then they're also having to go get lymphatic massages. And I don't know what length of time they've done that, but is it the same with any of the procedures that you do? Would your patients have to, or clients, would they have to do that as well?
Absolutely. Lymphatic massage is so important,
Mhm.
extremely important, and that determines actually the success of the procedure.
Oh, okay.
It's recommended that you do the minimum is like 12. Let's say you take like 3 times a week for the first couple of weeks, and then twice a week for the following 3 weeks. Some people go up to 30 massage. The more you do, the better it is. What does that do? What are the benefits of lymphatic massage? Not only it helps drain, the cut down the swelling, because we have significant swelling after the procedure. So you help drain that, get rid of the toxins as well. It help with restoration as well. Make sure the contouring is right. So it is such a great thing to have done. I know people, like I said, who make go up to 30, and then the results are spectacular after that. 12 is the minimum. We ask that, please, if you can afford it, because the price, it goes to $80, $90. So it depends on how much. If you take 90 or $80 times 12 versus 30, I mean, that's a significant. But if you're on the results that you need, so I think that you can go more. But minimum 12, but it can go 15, 20. And if you really want the perfect, so go to 30. I go to 30.
Okay. Let's talk cost. Like, for someone that's thinking about doing this, what kind of cost? And I know in different areas it's going to cost different things. What's an average cost if someone was wanting to do, whether it's the fat transfer, lipo, laser lipo, or contouring, or any of the other things that you may offer?
The price varies so much, and I have to tell you, our office is located in North Miami. Okay. Now, for the simple procedure that we do, if you are in Coral Gables, Aventura, or South Beach, the price almost doubles. Okay.
Wow.
Because of the location. In North Miami, we charge, like, let's say for the lipo, $4,000 per area. Let's say if you do the upper abdomen or lower abdomen, it's like $8,000. If you do the side, it's another $4,000. If you do the back, lower back, it's $4,000, and the bra line, another $4,000. However, we can combine it for you. And if you do 260, then we actually work with you. Work with you, because it depends on how much fat you have. And for the fat transfer, obviously, there's additional price for the fat transfer, from $2,500 to $5,000. It depends on the different areas that you want, okay, and how much fat needs to be transferred and so on.
Oh, okay. Whew, that's a lot of money, and insurance isn't covering this, right?
Unfortunately, no, insurance does not cover aesthetics area, because it is aesthetics, but it is what it is. The price of looking good and the price of to me, I've always said, image is the new currency. The way you look, if you look good, then you feel good. You smile more. You're more charismatic. You meet people. You have more opportunities. Because you feel good. You feel proud of the way you look, and then like that opens up all type of opportunities for you. So I think that is a great investment. And by the way, we remember, you don't have to come up with all the money right away. For example, because we have in-house financing, we have Cherry, we have or other things like that. You give some of the down payment, and then the company just finance you for like 2 years with no interest. So there are ways to, you don't have to come out of pocket with all this money. There are ways that you can really make it affordable for you as well.
Okay, because I was about to say, what can I get for $400? Probably a finger.
But I tell you, I've seen your face. Your face is impeccable. I don't see no lines. I don't see absolutely no, I'm not going to ask you if you got anything done, but you have a beautiful face, and it's so. I mean, I tell you, there is no, because as a physician, I look at, and I'm talking to you, I see no lines like that. So whatever that you're doing, keep on doing it, because you look good.
Oh, thank you. That makes me feel good. Thank you. So y'all in the chat, I can pass for 30 something. Now, we often see those before and after pictures on social media, and even in the commercials. I've seen a lot of commercials where it's the before and after. Sometimes I'm that journalist that's trying to see, is this the same person? But how how do you help people be realistic about their results? Because they may say, I saw, so and so on their social media, let's say a celebrity, and I wanted to look like this, but and you're they're sitting in your office, and you're like, let's be realistic.
Well, that is just a good question. A lot of the before and after pictures, they are done under ideal condition, the
Mm-hmm.
proper lighting. Sometimes use filters, and some of them are retouched. So, I mean, they really, really look good. So, it's good for you to look at them just to learn about the procedure, but do not expect the same results because it depends on the person. Uh, uh, Everybody is different. The skin texture depends on what you need to be done. It depends on your age. It depends on so many factors. So that's why it's good for you to sit down with your doctor, get a full evaluation, ask as many questions as you can. What should I expect? And education, and then like that you can really, okay, I expect that maybe I may not be 100%, but maybe 80, 90% of, if it's 100%, that's perfect, that's good. However,
Yeah.
do not expect it to be similar to the before and after, because that's not reality.
Okay. Now, I've also heard some people have actually I just heard this question today from someone when I was telling them about the show. They were saying, do you have to lose a specific, because I don't see them in the chat, so I'll just go ahead and ask their question. Do you have to lose a specific amount of weight before you have any of these procedures? I know that there's, I think, one company, I think it's here, where you need to lose a specific amount and have your BMI at a certain point so that the price won't go up. Is that
Absolutely.
true? Okay.
Your BMI have to be less than 30. If your
Mhm.
BMI, the more fat that you have, the higher your BMI. But if you are 30 or less, then you're a good candidate, because otherwise there's and remember, every state has different laws on how much fat that you can actually remove.
Mhm.
Like in Florida, for example, it's 4 liters of fat is maximum that you can remove. Okay.
Mhm.
Other states have more or less depending what it is. So at 4 liters is a good amount of fat that you can
Okay.
remove. So I would say yes. Um, um, that's the maximum that you can remove, and so on. Um,
Okay. Now, women in menopause. I've seen a lot of on TikTok and on my other podcast, a lot of chatter about, they hit menopause, then they gain, say, 30 to 50 pounds, and they just don't like how they look. So would your suggestion be, and they're struggling to lose that weight because of hormones. Now, would your suggestion be wait till you get out of menopause and then come see me, or do you have women in menopause that come like right when they're in the thick of it and go ahead and treat them? Because, I see the stories, the frustration, and they just want to feel like themselves again.
That's a very good question. My wife is a aesthetic nurse practitioner, and she works
Mhm.
with me at the office. And her specialty is actually weight management. So
Oh,
she
okay.
uses a lot of Manjaro and all of the other
Mhm.
triclopyzide, and it's or the compounding semaglutide, because those are extremely expensive. But the
Mhm.
semaglutide is a compounded medication that I give. You come once a week, you get your injection, and she monitors you every week. Okay, get you on the scale and get you to see the amount of fat that you're losing, and so on. And most people lose the fat, lose the weight
Mhm.
very, very, very efficiently, slowly but surely, and so on. So
Mhm.
when you reduce to a BMI become less than 30, now you qualify to go to do liposuction and so on. So there are ways to do this. And that remind me also to share with you that after you get a fat transfer,
Mhm.
please do not get on a diet plan, like take a diet program, diet medication, because otherwise you're going to lose the fat that you paid for, that you transfer to your face, your breast, or your butt. So the fat will go, because that's what happens. So do not go into some type of weight program reduction, because you're gonna lose the fat. And let me add something about BBL, because BBL is very, very uh, BBL stands for Brazilian butt lift, and most
Hmm.
people think that it originated in Brazil, but it's not. Is
Oh,
yeah, it is in this is in the United States. But the reason why they call it Brazilian butt lift because of the samba dancers, they look very sexy. Their butt is round. They have a tiny, tiny hip, a tiny waist, and so on. So, and this is what the term BBL come from because of the samba dancers or the ladies, the beauty models in the Ipanema Beach in Brazil. So that's what happens. Now, in the night, it started in the 2000, and in the 2010, when celebrities like Kim Kardashian and Nicki Minaj, Cardi D, I mean, when they started, go ahead and push social media, so that became
right.
very, very, very popular, and that's why they call the hourglass silhouette,
Hmm.
and and that encouraged people. Unfortunately, um, this is good and bad. This is good because the person very attractive. It's it's nice. It's nice. However, the size really makes a difference.
Hmm.
If it's nice, nice contour is great, but when it's big, I mean, some people go out of the way to really make it extremely big, and it doesn't look natural.
Hmm.
And then one word of caution as well, to make it big, not you have to put a lot of fat into the butt. Okay, and if it's on top of the muscle, it's okay. But if you go to the muscle, you have blood vessels there, and the fat get absorbed into a vacuum, and it goes to your lungs, causing pulmonary fat embolism. And some people have died because of that. I mean, in Miami, I've seen people coming from out of state coming to get to these places where they do a lot of volume, a lot of volume,
Hmm.
and then they're not paying the kind of attention that they should, and then they get fat embolism in people. I mean, these people die. So please be careful about where you choose to go to get this procedure done, because it's not good when you come, you want to look good, and then something happens. This is tragic. So that's something that you really should consider.
I'm glad you brought that up. I was just thinking about a TV show on Netflix, and I don't uh, want to name the show because I don't want to spoil it for anybody. But there is an incident where there is someone on the show. It's a scripted show where she wanted to look good, wanted a bigger butt, and had the surgery, but had it in a non-surgical site, like, not in a hospital, not in a surgical setting, and ended up like exactly what you said. She was about to die because of those precautions weren't in place, and they probably just went to the, like you said, to the muscle. And so yeah, it just made me think about that as you were talking, and then thinking about some of the other stories we've seen in the news about some celebrities that have had issues with BBLs, or have reversed them. Can you talk about reversing them? How does that? Can you do that, especially if they come to a facility like yours? Can you reverse that?
Well, you do this because remember what makes a BBL. This is fat. So if
Hmm.
you reverse that, what you have to do, just do liposuction in the butt to remove the fat there. So that's what
Gotcha.
you call reversal. And there's something as they call non-surgical BBL. This is
Hmm.
using fillers like Sculptra or with yes. Have you heard of Sculptra? This is like one of the fillers that you use, but it is extremely expensive because one syringe of that Sculptra costs a lot of money. Just imagine you might need 10, 15, 20. It's safe because you just put fillers into the butt. Okay, but it's just expensive. It's just expensive, and
Yeah.
that's why they call it non-surgical BBL.
Okay. Okay. Guys, we've got Dr. Rudy for a little bit longer, so make sure you drop your questions in the chat. I want to make sure y'all's questions get answered as well. So, okay, you answered my question about that. See, I just got all sidetracked. But let's talk about the face. What are those fillers? What's PRP, threads? How do those treatments enhance your facial appearance without looking overdone? Like I can't remember the lady's name, but she had all this facial, all these things done to her face, and it was like she just looked disfigured. And she just passed away. She was like 80 something years old, but she had like, I think it was something where somebody injected the wrong thing into her face, I think is what it was. But so tell us about all the things that you can do to the face.
Okay, PRP is platelet-rich plasma. What it is
Okay.
that we take your own blood. We have
Oh.
this, we have a special centrifuge that we put it in, and the platelets become very, very concentrated, and then the platelet have all type of growth factors in them. So
Mhm.
when we inject you under the eye or in the face and so on, have you heard of what they call it vampire facial?
Mhm.
In fact,
Yeah.
this is using exactly this. This is using a PRP for your face, and your face looks very, very refreshed. And this is, but don't forget, this is your own blood, your own thing.
Mhm.
So it looks so natural, and it feels all of the spot there. Most of you watching right now, do me a favor. If you have a mirror, take the mirror. If not, take your fingers. See if there's a line next to your nose. They call that nasolabial folds. You don't have it.
Oh, okay. I was like, I don't feel anything.
Nasal. See, I have a little bit of it. They call it nasolabial folds right there. Okay.
Okay.
And then a lot of people they have this fold as you get older, and also they lose volume in the temples and the face under the eye. So by replacing it with PRP or fillers and so on, and or fat, you
Mhm.
look like 10 years younger. And this is so quick, so efficient, and that help do this to you. See, already
Mm.
see, just by when you pet that, and then your temples, the volume comes back and so on. I mean, you look like 10 years younger. Except if it's fat, it's good for a long time. And if it's a PRP or a PRP less for maybe a year, if it's a uh, like Juvederm or some of these Restylane and things like that, last maybe 8 months, and every so often 1 year that you have to get it, back again and so on. So that's for facial steady. And the threads are also great. It's like a
Mhm.
non-surgical facelift. The thread, you put the thread like this here. It pulls the skin up, and then the thread itself inside, they stimulate collagen and elastin to form, and help tighten the skin as well as one. So it's very, very very, very efficient. One thing that a lot of people come in for, like double chin,
Mhm.
double chin, and that's because of some fat and so on, and or loose skin. And there are ways also to tighten the skin and remove some of the fat there as well, using laser or using. There are two technology that they use a lot. Is they call it the Action Prime. This is a technology by Alma Lasers, and it has both the ultrasound and radio frequency. When you're pregnant, for example, you go and get an ultrasound in the hospital, and the
Yeah.
sound wave measure the size of the baby, or if you have like a breast tumor, whatever it is that measure. But this is a special type of ultrasound in target the fat cells, break down the
Mhm.
fat cells, and then help eliminate it to the lymphatic system. While the radio frequency energy just go ahead and help build new collagen, and then to
Mhm.
help tighten the skin as well. So that's a great technology they call Accent Prime. You may want to take a look at it and so on. And the other one that's very popular is Morpheus 8. You guys always heard of Morpheus 8.
Mhm.
This one is very effective in tightening the skin, also good for cellulites, but is painful. We need to put some topical cream on there for you. You can use it for the face and for the body, to cut down the pain. But it's very exciting. You have these tiny needles that you put into the skin, and the radio frequency goes into these tiny needles, causing micro injuries, and then that causes a buildup of collagen to help tighten the skin. So that's another technology, non-surgical as well. And lastly, there's something they call the Evolve Evolve X. Another
Mhm.
technology forming mode. It has three different modalities: trim, tight, and to tighten the skin, and also build up the muscle. Not only remove the fat, but use electrical muscle stimulation to build up muscle wherever that you want it. This is just like going to the gym. If you put this machine around your abdomen and
Mhm.
then turn the electrical stimulation on, this is just like doing 4,000 sit-ups in 45 minutes. Do you see when you go to the gym how many sit-ups that you have to do? Okay. Now,
Mhm.
in 45 minutes, just like doing because it helps the muscle to contract and so on. You do that once a week for 6 weeks, and you see a big difference in your muscle. I'm not guaranteeing that you get a full six packs, but
Right.
you're gonna look good. You're gonna look good. So there are
Oh.
tons of non-surgical
Mhm.
methods, technique that you can do to really look good in body contouring, and also fat transfer and things like that.
Okay. Well, what questions should someone ask their provider before choosing, if they should have a cosmetic procedure? And how should like what steps should they take to even find the right provider for them?
Number one, do your research. Okay,
Yes.
speak to other people, and make sure that you doctor is board certified. Because I tell you, in Miami, I don't know anywhere else. Miami, you have the best and you have the worst. You have people in the garage, okay,
Mhm.
doing this kind of procedure. And sometimes they're putting for the butt, they put all type of stuff in there,
Mhm.
so please do your homework, choose a board certified physician, making
Mhm.
sure the center is, is approved by the state, or what do you call it, accredited. And then as the doctor question, exactly what should I expect? What are the side effects?
Mhm.
How soon the recovery time? What can I do and what I cannot do? The more educated you are, the more question you ask, the better that the results will be, and so on. So like that,
Mhm.
there absolutely no surprise. And of course, the cost. So like that, there's no surprise. You know exactly what to expect.
Mhm. Have you ever had a is there like a success story that you could share of someone that walked in and you were just so proud of the finished product, what it I don't want to call it product, but how they looked after and that their confidence just soar after going through whatever procedure they chose?
Oh, absolutely. We have so many success story, and unfortunately, um, when individuals come to get this work done, we love to get them to before and after, and for them to talk about it on
Yeah.
on camera. But
Mhm.
people are kind of very, very private. They don't want to know people to know their business. You see what I'm saying? So it's very difficult. um, but yes, we do. We have absolutely we have a lot of people with sexual difficulty, and when
Mhm.
they come and get treated, obviously, the life changes, and so on. And then for body contouring is another area. Yeah, I mean,
Mhm.
when you look nice, tight,
Yeah.
it's very good. And if I don't know how much time we have. I'd love to hear a personal
Mhm.
story,
Yeah,
how
sure.
God started. I when I was 16, I was the subject of jokes growing up, because I sucked my thumb as a,
Mhm.
as a as a kid, so my teeth were actually pointed out, and my peers was calling me, a beaver, and the girls wouldn't go out with me, so I was depressed. I felt that I don't belong. uh,
Mhm.
and I told my parents, please, can you take me to the dentist and get my teeth corrected? and
Mhm.
and they did, and it was like night and day. My teeth were normal, and suddenly I was accepted, and the girls started to accept me now. And that built up my confidence so much that
Mhm.
eventually I became an overachiever.
Mhm.
Not only I'm a physician, but I'm also an attorney. It's a long, a flight surgeon. I did some acting. I did,
Mhm.
so, and
Mhm.
now, certified anesthetic. So that kind of, and now when somebody comes to me, that reminds me of the time that I was not handsome. I was
Mhm.
not, I had my teeth bad, and so on. And I always remember that. I say, you know what, and I'm gonna try my best to make you look good and feel good, because this is important.
Oh, wow, that's a very inspiring story. I forgot to ask one question about, I asked the question about women coming in during menopause, but I forgot to ask about men. What procedures do men do you see men coming in for a lot?
Men come used a lot for the Evoke X machine, because it does the trim, the tight, and the tone.
Mhm.
And the procedure takes about 1 hour and 50 minutes. They lay down and they're on the phone. It's okay, because the machine is working, and you can increase the intensity every time you come in. The stronger the intensity, the more the contractions. So they come once a week for 6 weeks, and then they're really happy about the result on this. And also men get liposuction as well, but more women select liposuction, than men. Men come in to get the other procedures done. Body contouring, the accent prime that I said using the ultrasound and radio frequency, but not too many men comes in for liposuction. And there's a perception for men that it's like they don't want to feel that they're doing too much to the body. Women wants to look beautiful. I mean, that's what they want. Men say, I'm all right. I'm all right, man. You know what I'm saying? So you have to kind of
Right.
teach it. Look, and sometimes I give my own example. I say, look, how old do you think I am? So I am 70. I'm 70 years old, and I'm
Wow.
solid. So I'm saying, so I actually practice. The reason I'm speaking that because I have personal experience on this. I mean, looking at 70, looking like this, it's that big. Well, I work out like 4 times a week. I really think I eat properly. And I do my procedures. I cheat. I get my, I do a little something, once in a while, and I use my equipment,
Yeah.
So So
I would do the same. If I had that equipment, I would use it too. But I looked at like I was telling you backstage, I looked at your Instagram, and if I hadn't Googled you, I wouldn't have known that you were 70. I would not have thought that at all.
Well, if any one of you come down to Miami, I would love to give you a tour of our facility. We have some of the best technology there. Just walk you through so you can see. And someone would love to just mention that you came from from Soulibration, and then we'll give you a tour, and then we'll see if we can help you.
Okay. All right. That sounds good. I want to thank you for coming. But first, I have one last question for you. And it was not on the list I sent you. But what feeds your soul?
I am a philanthropist, and be able to help as many people as I can. To me, that does it for me. The satisfaction of being able to. I mean, I try to. I try to help as many. My wife after me all the time. She said, "Look, can you take a break? Why do you want to help everybody?" I said, "I'm sorry. That makes me feel good to be able to help." As many people as possible, either a contribution, either by helping a solution, entering letter of recommendation to go to law school, medical school, whatever it is, or so on. I mean, I try to help as many people as possible. That makes me feel good, And students, I welcome students. I teach them. I'm a role model for them, and so on. And I have doctors now who started with me as a student. They wanted some advice, and now they're board certified physicians. That really make me feel good as well.
Yeah, that's a great answer. Wow, thank you so much for taking the time to come and explain all of this to us. I know I am in my head like, okay, I want to check out all of these procedures here. And so I will be doing my research. And if I have any questions, I'm just going to reach out and ask you if that's okay.
Absolutely. That's what I'm here for.
Okay. All right. Well, for more information on cosmetic enhancements that we talked about today, you can also head over to blackdoctor.org and search for articles there. Do you have a website as well that people can check you out at?
Yes, we do. Well, first of all, our Instagram is CMA Miami, and then our website is CMA Aesthetics without the S. CMA Aesthetics without the S.
Okay. Y'all make sure you check that out. But next week, coming up on Soulibration, we're hitting the trail, like literally. Okay, no, we're not really going outside, but I'm talking with the founders of Soul Sisters Hike, and they're an Atlanta-based movement helping Black women break free from the strong Black woman narrative through mindful hiking and nature connection. They are taking it literal, like go outside and get in nature. So we're going to explore how chronic stress shows up in our bodies and how movement and sisterhood and being outdoors can help us reconnect and heal. So you don't want to miss it. That's next Wednesday at 7:00. Right here live on blackdoctor.org. Thank you again, Dr. Rudy. It has been an absolute pleasure to chat with you and meet you. So thank you for joining us. And thank you guys in the chat. I hope everyone has a great night.
My pleasure. Thank you.
Thank you.